Hello, I'm Dr. David Rehak from the Hughston Clinic. I'm an orthopedic surgeon. I specialize in and limit my practice to problems of the hand and upper extremity, including the elbow, forearm, wrist, and hand. Today we're going to talk about carpal tunnel syndrome. Carpal tunnel is a compressive neuropathy of the median nerve at the wrist. That means that the nerve is pinched, compressed, tight, or trapped. The symptoms are most commonly seen in the fingers, hand, and wrist. Patients will describe their symptoms as their hand feels asleep. It feels like it's numb or tingly. Some patients will state that their hand feels swollen but doesn't really look swollen. Some patients will feel like they're wearing a glove. Some will state that their hand just doesn't feel right. Symptoms at night are very common. Patients will often tell me that they're waking up at night, shaking out their hands with numb, tingly hands. The yellow structure is the median nerve. It passes through the carpal tunnel. The carpal tunnel is formed by the wrist bones, shown in green, which make up the floor of the carpal tunnel, and the transverse carpal ligament, shown in white, which makes up the roof of the carpal tunnel. 9 flexor tendons also live in the carpal tunnel with the median nerve. Inflammation of the tendons, also known as tenosynovitis, can cause increased fluid in the carpal tunnel, which again will increase the pressure on the median nerve and cause carpal tunnel syndrome. The diagnosis of carpal tunnel syndrome is straightforward. It begins with a history and physical examination. X-rays can be very helpful to rule out other problems. A key aspect in the diagnosis of carpal tunnel syndrome is electrodiagnostic studies, commonly referred to as EMG and nerve conduction studies. The treatment for carpal tunnel almost always begins with conservative care. A splint and anti-inflammatory medication can be very helpful. Oftentimes a shot or an injection can also be helpful. However, if conservative management fails, there is an excellent procedure known as a carpal tunnel release that in almost all cases will cure this problem. Carpal tunnel surgery is done on an outpatient basis using local anesthesia with IV sedation as needed. The objective of carpal tunnel surgery is to release the pressure from the median nerve. This is done by releasing or cutting the transverse carpal ligament. There are several different techniques to perform a carpal tunnel surgery. All have been shown to produce very good results. In general, the results from carpal tunnel surgery are excellent with very few, if any, complications, and it's fair to say that carpal tunnel syndrome is a curable problem.